evening, everybody. Hello. Let me introduce myself. I'm Alton Condra. I'm a pharmacist at Grady Health System's Infectious Disease Program, and this is my esteemed colleague, Dr. Manish Patel, a pharmacist, HIV guru specialist. Yay! Everybody say hello to Manish. Okay, so hi, Manish. You get applause. I don't. Okay. Manish is cuter than I am. We got it. Okay, we need to go over some housekeeping rules, that fun stuff. So, first of all, I do want to say thank you to all y'all for coming. The name of the class is Management of Adverse Effects of Antiretrovirals, Part 2. These are the protease inhibitors, integrase inhibitors, and CCR5 inhibitors. If you missed Part 1, that is perfectly all right. Part 1 has been archived on HIVtalkshow.com, and you can watch it on demand and still take the test and get CE for it. Now, we want to thank two wonderful organizations, GSHP, the Georgia Society of Health System Pharmacists, and ANAC, the Association of Nurses in AIDS Care. They actually brought this class to both pharmacists and nurses today, and I really want to thank them. Let's give those organizations a round of applause. They are wonderful. And we'll thank HIV Talk Show for making it all happen through the internet and all the things that they do. So yay for HIV Talk Show. Now, also, we cannot do this without financial support. We actually got unrestricted educational grants from the following drug companies, and we want to give them a big thank you. We have Bristol Myers Squibb, that I call BMS. We have Boehringer Ingelheim, which is I call BI, and Gilead. So thank you them for giving them a round of applause for actually helping pharmacists and nurses make sure that they are educated as well as physicians. So let's talk about what we're trying to do. Well, despite tremendous progress in HIV care, we know that adverse effects are very common with any drug, especially the antiretrovirals. Make sure that what's our goal? Well, we're trying to help manage those side effects and adverse effects for our patients so they stay on their medications. If they stay on their antiretrovirals, their quality of life will improve. We keep HIV under control, and that's very good for living long and healthy, prosperous lives. Now, this is a bias of mine, and I'm just going to tell you it's a bias. I truly believe that the people on the front line of healthcare today are pharmacists and nursing staff. So pharmacists and nurses, give yourselves a round of applause, because y'all are, to me. I know the physicians get all the credit and glory in the world, and I think that's great, because they are wonderful people, and I love them to death. But you will get the first phone call, I guarantee it, on a Saturday night, because I personally do not have my physician's cell phone number, but I can call my pharmacist or nurse anytime. So that is where I think y'all have really played the biggest role.
As Alton mentioned, the regimens that we've had the last several years have become more and more complex. There's different combinations, different drugs. So obviously managing the adverse effects becomes very important, ultimately to improve quality of life and adherence.
So what are we going to talk about? Let's get proactive. What do I mean by proactive? All of y'all have had patients who have come to y'all wanting to ask questions. And you are, like I said, already the primary source of information. But when you get proactive, you've got to make sure that your patient is comfortable talking to you about adverse effects. Now, we're eating dinner, and I hate to bring this up at dinner time, but if you've got to talk about diarrhea in front of a bunch of people, that's not cool. That's not something you're going to do easily. I don't want to talk about it even with my physician in a private room. So if you're a nurse or pharmacist, make sure they know that you are there for them. You can help them. If you don't know the answer, you can find the answer. But you can help manage them through these side effects and help them stay with a good quality of life. That's what I mean by getting proactive. I have to hold their hand a little bit, but it's especially important. Now, pharmacy technicians that are in the room, and pharmacists and nurses and case managers, make sure you always stress to keep your physician's appointments and make sure your physicians are doing lab work. Some side effects can appear without you never knowing about it. And the only way you'll know is through lab work. So make sure you're always stressing that to every patient. Keep your appointments and stay in care, always. So here are some of the drugs we're going over tonight. The protease inhibitors, the CCR5 inhibitor, and the integrase inhibitor. I'm going to spare you the slaughtering of these generic names by me. So everyone laughs when I try to do generic names. So you'll hear me refer more to the name brand name because it's easier for me. And you'll hear Manish, who's fancier and smarter than me, actually use the generic name. So you'll have to learn how to switch back and forth. If you want me to try to do the generics, let me know. I will slaughter them for you and have a lot of fun. So And these are all the drugs we went over in part 1. If you missed the class, then you can go over and take the class again. It's on demand like we mentioned. Or if you've already been to part 1, you know all these answers. We may be throwing a question from part 1 at you, so be ready. Now, if you want to know how everyone gets so smart on HIV, I'm going to tell you a secret. People like me cheat. We actually go to the places where it actually breaks it down and makes it simple for us. So the DHS guidelines is a wonderful place. You go to aidsinfo.nih.gov. This is a wonderful website. It tells you charts and tables and breaks it down what drugs go with which. It's a wonderful resource. And when a clinician's not around and a physician or a nurse or a pharmacist even asks me a question, I go to this website real quick and then I'll get back to them with the answer and they think I'm brilliant. So it's a great resource, so please use it. So here are the protease inhibitors, once again, that we're going to go over. So here we go. So let's talk about GI intolerance. What is GI intolerance? Name me some things. Y'all shout it out. When you think GI, what's some of the common things you're automatically going to think about, especially in the protease inhibitor class? Nausea. I hear nausea. What else? Abdominal pain, diarrhea, vomiting. These are all the GI side effects that can happen with protease inhibitors. And you'll hear those pretty commonly with PIs. So when you're managing those, you need to make sure that you roll out other causes that may be causing diarrhea. For example, you may have an infection that has nothing to do with the protease inhibitor. You can take care of that infection, and then diarrhea will go away. Also, with some of the nausea and diarrhea and vomiting, that actually may improve over time, and I've actually had patients tell me it's gone away completely. So it actually can resolve over time. So when a patient is first starting, you just start out slow and make sure that you're doing that hand-holding like we talked about earlier. Now, for some patients, you may actually have to use drug therapy. Like, example, an antiemetic like promethazine. Can anybody name the name brand for that one? What's Phenergan, that's right, Phenergan. And do you do it 30 minutes before you take the protease inhibitor? Do you give the Phenergan, or do you do it at the same time? Before, how many minutes? 30 minutes. Why? It takes that long. It takes 30 minutes for the Phenergan to start working. So that way it reduces the nausea. Also, the old-fashioned rule, you can always take it with food if possible, right? Food is a good way of helping reduce nausea. Well, but diarrhea, you have to make sure that you always say this with any patient having diarrhea, monitor their fluids and their electrolytes. You might get a bulk-forming agent. Every grandma has this in her medicine chest. What is it? What does every grandma have? Metamucil, there you go. You can also use loperamide, which the name brand is Imodium, that's right. Diphenoxylate, name brand, Imodium, and calcium tablets. That's all the generic names I'll say tonight. So you can also use those for diarrhea as well.